Good morning and good afternoon, colleagues and friends. Thank you so much for joining us in this very important special COVID-19 session, number 41, where we are going to be discussing the Africa CDC Trusted Travel Platform, which is going to be looking at creating a trusted network of COVID-19 testing laboratories. As the African Society for Laboratory Medicine, ASLM, we believe strongly that the role of the laboratories will remain very critical while the countries continue to roll out their vaccination programs. Therefore, delivering trusted laboratory results, I will underscore that trusted laboratory results will be critical to opening borders and economies. Therefore, the Africa CDC and ASLM and PanaBios are coming together to strengthen the concept of a trusted laboratory COVID-19 testing network across the African continent using an innovative digital technology. So 3 things we want to achieve today in this webinar. Number 1, we want to discuss the digital innovation that seeks to create a bridge between Africa's high-quality laboratories and seamless travel. Number 2, and how the proposed trusted laboratories digital infrastructure could help governments make decisions about which laboratory they can trust to provide COVID-19 tests for travelers. And finally, building on previous PEPFAR's investments on the process of quality improvement, one that we call the SLIPTA process, we want to initiate a conversation on how laboratories in the continent can be certified to create this trusted network for COVID-19 testing. You may already have been seeing articles, publication, maybe even in your own country, in terms of challenges that we are facing with regards to COVID-19 tests being issued as fake. And I've just pulled out 2 of them just to show you the current challenges that are facing, especially the travel industry and especially the governments. And people are having to test in one country, and also when they land to another country, they have to test, all because the issues of trust are very critical in terms of the results that every government has to decide on in terms of allowing different travelers into their countries. So to help us really discuss this important issue, and also try to find solutions, our African solutions, to creating a trusted laboratory network for COVID-19 testing. We have got distinguished presenters that are going to be talking to us today in the name of Dr. Ahmed Okwel Ouma. He's from Africa CDC and he's the Deputy Director. We are also going to have Dr. Adam, who is going to be replacing Paulo Gomez. And Dr. Adam works for the Afro Champions and is going to be making a presentation on behalf of Paulo Gomez, who is working for Africa Union COVID-19 Response Fund. And finally, we are also going to have a presentation from Dr. Tokmo Marota, who is the Senior Biosafety and Biosecurity Officer from ASLM and also seconded to the Africa CDC. So just to note some rules as we start this webinar, this is a 1-hour webinar and there is translation that is available from English to French. And we will start with some PowerPoint presentation, then later we are going to be taking questions and answers. If you've got any comments, if you've got any questions, please feel free to enter them into the chat box. So at this point, I'm going to invite Dr. Ahmed, who is going to be giving us some opening remarks. Over to you, Dr. Ahmed.
Thank you very much, Kobile. Good morning, good afternoon, good evening, colleagues, wherever you may be. It's indeed a pleasure for us at Africa CDC to be coming together with our long-time implementing partner ASLM And today on a very important topic around how we can safely bring back confidence to travel, how we can safely bring back confidence to these certificates that we use to travel, and eventually even the vaccination certificates when they start operating fully. And I would like to say three things here. First, of course, is to thank you for making time. I can see the participation is really good. We are over 200, and this is a very good beginning to a very important topic for discussion. Secondly is that this particular pandemic has hit everybody, the young, the old, the rich, the poor, the wealthy countries, the not so wealthy countries, every part of the world. And as Africa, it has particularly hit us hard because most of our economic activities depends on us waking up, going out, seeking income, and then bringing it back home for the family to be able to partake. So any disruption in our ability to get out and look for that income, whether it is within our own villages, towns, countries, the continent and beyond, it certainly has had a very big impact. And the economic outlook is such that if we don't bring this to a quick control, then 2021 would certainly be just as bad as 2020 was. So that confidence, we are looking for ways of ensuring that we bring it back so that people can then be able to go back to their activities, not as normal, but at least with a level of confidence that will allow for growth of the economy again. The third thing I would like to say is there is no other way of us getting that confidence unless we have confidence in our testing instruments, unless we have confidence in the information that is being shared, whether it is about testing, it is about treatment, it is about vaccination, it is about any information related to this pandemic. We must be able to bring back confidence in that information. And the only way to do that is to put in place systems that work, systems that are going to be easily trusted by Africans and those who are coming onto this continent to enable us to become more active again in the field. So this particular session today is going to touch on a very important topic around how systems are being developed that can be trusted, and with that trust, the confidence to be able to travel around will also improve, and economic activities can also be able to improve. So in collaboration with PanaBios and ASLM today, let us have a very frank and open discussion. We see what the challenges would be, and we document those carefully so that we can be able to tweak and refine the way in which we are collecting testing data, the way in which we are making it available for governments and then particularly travel sector to use confidently, and the way in which we can be able to use that data to improve our response on the continent, to improve our preparedness for the next one that may come, in fact will come, looking at the trend now, and the way in which you and I can be able to play a role in ensuring that the trust is real, the confidence is secured, and our economic activities can then be able to take off once again. I can be able to share with you that as Africa CDC, we are fully committed to ensuring that these trusted travel systems are not only functioning, but they are also providing the correct information for us to be able to gain trust again and confidence again in travel and business across the continent and beyond. So Kobile and team, it is really a pleasure to be part of this process today, and I'm looking forward to a very robust discussion and a good outcome from today's session. Thank you.
Thank you so much, Dr. Ahmed, for those wonderful and excellent remarks. And it's so encouraging to hear that Africa CDC is fully committed to creating these trusted platforms. And the issue of trust is becoming a very delicate issue given that countries want to open borders, travel has to happen. But we need to ensure that our systems build that confidence, and this is the discussion that we are having today. So I would like to invite the next speaker. I'm going to ask Dr. Adam and Tim to make a presentation, and they are going to be looking at what is this trusted travel lab platform, and what is the model, and how is it going to be implemented. So I would like to leave this time to Dr. Adam and Tim to take us through this presentation. Over to you, Dr. Adam.
Thank you very much, Mr. Ndovlu, and also thank you, Dr. Ahmed Ogwell, for those very insightful remarks. I'm just stepping in by happenstance for Paolo, who is having technical glitches. And since I'm on the road, I've asked my colleague who is sharing the screen to advance the presentation. So we'll take it from there. Thank you.
Thank you very much, Dr. Eden. Thank you very much, Dr. Ndlovu and Dr. Ogwell, for setting the scene. We're very grateful for this opportunity to present the work that the Africa CDC and the African Union, obviously, has been doing so far in this very important area, and the early work that has been done is being done with the ASLM to get to a common understanding of what will be required to create a trusted medical data exchange system for the continent. So I'll go right into the presentation without further ado. I must remind you that this is an African Union initiative that is spearheaded by the Africa CDC, but heavily supported by the private sector. And obviously, given the particular discussion that we are having today, we consider laboratories, medical and clinical laboratories, to be at the center of this entire initiative. ASM's mandate in particular is critical if we are to increase trust in medical data interchanges. And medical data interchanges are without doubt the most critical element of an evolving e-health logic and concept around the world. Being able to transport data or to transmit data from one jurisdiction to another, and that other jurisdiction being able to treat that data as if it was originating from their own jurisdiction, is a long-standing problem that has bedeviled our sector for many, many years. It is quite inspiring to see that some of the solutions are coming from Africa, and perhaps we have the opportunity to set the framework that the rest of the world will follow. But what are the problems we are trying to solve? And how do medical data interchanges play a critical role in addressing these problems? We know that the current remedy for the pandemic, particularly shutdowns and restrictions on mobility, are not sustainable in the long term. In the short term, obviously, they are critical, but in the long term, we have to loosen some restrictions if we are not to create a much bigger problem for the livelihoods of the millions of Africans around the continent, many of whom have very contingent economic circumstances, by which I mean they live hand to mouth. That requires, therefore, that some of the restrictions that we've had to impose from time to time will have to be loosened, especially in the area of mobility. But we cannot do that by risking an exacerbation or an acceleration of the pandemic, and that is very critical. Lives and livelihoods are neither dispensable, and therefore we have a mandate, particularly those of us that are in leadership positions around the continent in whichever capacity, to come up with solutions that will ensure that we can protect lives at the same time as we are protecting livelihoods. In that context, what has happened is the growing use of digital credentials of various kinds as an attempt to approximate the paper-based health credentials that many jurisdictions now are attempting to use to balance this twin risks of protecting, or rather of endangering lives or endangering livelihoods. Some of these credentials include obviously test results and vaccine certificates. Digital equivalents of them are more likely to be verifiable at a lower cost and with higher accuracy. the challenge is, if we do not have a system that enables such verification to be seamless and low cost, then what we have is a situation where mushroom labs spring up overnight, in some cases completely fake labs, or even in worse instances, individuals themselves generate these self-credentials in their own home. Let's not be shy about the matter at stake. In a pandemic, particularly of a disease that is this contagious and can be potentially dangerous, we have a remit to ensure that people, when they are sick, stay home. If they are to travel and to exercise their mobility rights, they need to do so without infecting other people. That therefore requires that we have a means to verify the credentials that are set, that to a high degree of certainty, they are not likely to transmit disease. Of course, it's important that we accept that there is no 100 degrees assurance and no system can ever provide 100 degrees certainty. Nevertheless, risk management requires that to a high degree of probability, we are able to tell that a person that is moving is not spreading disease, especially in a cross-border context where imported cases confound the ability of specific jurisdictions to manage the pandemic within their own settings. And now we have the even more confounding situation of variants that appear specific to a particular area, suggesting perhaps that those kinds of variants may develop may lead to specific immunities in those particular jurisdictions, but not immunities in other jurisdictions. So cross-border movement conflate an existing problem of imported cases with imported variants for which immunity may not have developed in a particular locality. The role of accredited professional labs in generating credentials which minimize this risk of spread of disease therefore become an incredible global public health objective. And it's this global public health objective that the African Union, through the Africa CDC and its partners, is looking to work with the ASLM in coming up with protocols that ensure that this overall ambition can be attained with minimal room for error. That is the whole point of this Trusted Labs framework. The process starts with countries being recognized as having sovereign jurisdiction over their own territory and therefore being primarily responsible for protecting the health of the populations that live in that territory. The process that has been developed at Africa CDC with the support of Pan-African organizations and with the input of specialist organizations such as ASO and others begins with countries being given the tools to digitize their current entry and exit protocols. And of course, that is the foundation for any potential harmonization around the continent. So in digitizing the protocols, they indicate things like what particular types of health credentials are allowed, what should be the characteristics and attributes of those health credentials, whether they are vaccine certificates, quarantine certificates, PCR test results, whichever health credentials they may be. They also indicate, as I've already mentioned, what conditions may invalidate those health credentials and what the process of validation may be. All of these go into a checklist, a kind of algorithm on the platform that, in essence, reduces the discretionary factor available to officials so that we have a harmonized and a standardized process across the continent. So in essence, if you're a country and you are part of this process, you have a digital infrastructure that is made available through the Trusted Travel Initiative, so you can digitize your entry and exit protocols. Once that has been done, Africa CDC and other supranational authorities play a role of ensuring that the processes that are in place across the continent are increasingly harmonized. And that is the whole basis of health cooperation, for which reason supranational bodies like Africa CDC were established. Furthermore, having digitized these protocols it is now possible to provide authoritative information to travelers, airlines, other transport authorities, etc., about what the current travel restrictions or travel protocols pertaining to a particular jurisdiction are in real time. So in simple terms, there are APIs that airlines and others are able to connect to fetch the data and feed that data to the general public online, as well as through partner infrastructure such as airline websites, as an example. If you're a travel agent, you are able to plug into the same system to collect data regarding the latest travel restrictions in a particular country on the continent and deliver that to your stakeholders or your customers. So that's the starting point of this framework. And very invariably, the laboratory-related measures take center stage. So measures like particular types of testing, and eventually perhaps particular types of vaccines that are recognized in the country that is the destination of the people that are traveling who are seeking this information can be delivered in real time. It also could include, and the authorities have the right to determine if particular laboratories are the ones authorized to provide these health credentials that are valid for their own country. I'll repeat that because it's important. Countries authorize laboratories within their own country before they appear on the platform as a starting point for the accreditation process that this Trusted Lab framework enables. But countries are also able to determine if laboratories outside their country should be allowed to generate health credentials that apply for cross-border screening purposes in their own territory. So it's a dual mandate. Now I'll go into a bit more detail to elaborate these points within the short period of time that I have left. First of all, it's a human rights imperative that we identify the least burdensome and the most cost-effective mechanism that can enable individuals, regardless of their socioeconomic status, to cross borders if that is essential to their livelihood. So if you have traders that want to cross borders, if you have people that are schooling in one part of Africa and they have to cross borders to go to school, if people are trying to invest in other parts of Africa, the entire basis of our union rests on us being able to move across the continent in an atmosphere of relative convenience. That human rights imperative requires that we find mechanisms that do not lead to the spread of disease, because we also have a right to protect populations across the continent from disease. And that is the basis, the human rights basis of any mechanism that enables movement and mingling in a time of a pandemic. I've already indicated that we do have international health regulations. We do have United Nations Security Council resolutions and others that have already laid the base of international law for these kinds of data interchange that, to our mind, does reduce the risk to everyone when it comes to travel, including the traveler. So these measures are not merely police measures. They are not merely policing measures. They are part and parcel of validating the human rights of both travelers and the host communities to which those travelers are moving. The second important element is the quality assurance framework that digitization enables. One of the critical ones is the ability to use different types of data, such as vaccination data, test data, and the rest, to validate the quality of the testing through big data algorithms. So for instance, if laboratories generate particular credentials, over time, due to rate testing and other factors, the system enables data to be generated to assay the quality of the test results at an aggregate level and increasingly to a per lab level. So the laboratories that are indeed observing the standards that are expected in this type of framework have an incentive to continue to invest in them, because the system in time brings the transparency and the data-driven assessment models that are necessary to establish the integrity of the overall process. Indeed, it's also possible using these mechanisms to determine whether even the vaccination protocols that we are currently embarked upon are indeed as solid as they say they are, simply by cross-matching testing results with vaccination data in time and or over time. These kind of sampling mechanisms provides a completely different or novel context for us to assess how we can use data-driven decision-making to improve the current framework of risk management that is emerging in the new public health order, as the Africa CDC calls it. And of course, the same data will be very useful because it's also coupled with travel data in determining the paths, the wavefronts, the transmission dynamics of new variants as they emerge. We consider these are technically complex areas that will require continued research, but the possibility and the prospects are very clear. If we are able to combine vaccination data, intermix that vaccination data with testing data, if we're able to isolate specific interconnections among those data points, particularly using retesting data in different facilities and the rest, we get closer to being able to determine if a particular immunity threshold holds, a particular testing mechanism remains valid, etc., etc. That is not possible with a paper-based system. Any manual system is inherently difficult to transform into the kind of data-driven, analytics-based risk management tools that we need in order to get to the point where we are able at a certain stage, to make very surgical decisions around movement within countries and around countries. So in simple terms, somebody obviously goes to a laboratory and indicates a willingness to be tested. That person is tested. That information is uploaded to some kind of LMIS. That information goes to some kind of national repository. It's also at that stage that a unique reference is created for at least four elements: the traveler, the test that was conducted, the sample, and obviously the particular context of travel, as in the destination, etc. Now, with these elements, having identified the traveler, the sample, the test, etc., a unique cryptographically secure code called the Trusted Travel Code is generated. That code is verifiable anywhere in the world, and particularly now that the UNDP has also decided to sponsor complements to this system, it even covers laboratories outside the continent. With these unique codes, a number of possibilities arise. One possibility is obviously what most of us are already familiar with, a digitized version of how to do cross-border health document screening. So I present some document, the authorities are able to scan that document and in real time verify which laboratory it came from and whether it satisfies the protocols, the entry protocols of the country in which the person wishes to secure entry. That is one. But it's also possible, obviously, that with the same system, we can create safe bubbles within our communities, workplaces where people that are not transmitting are allowed to come in and others work remotely, events where everybody in that event is hopefully not transmitting. I repeat, there can never be 100% assurance, but a risk management framework works in probabilities, and our goal is to provide the data assurance and the integrity assurance that makes those probabilities useful to drive decision making. Once that process is in place and the data is queryable, you are able to stand at the border, as an example, and validate if a particular test credential or any type of health credential, including vaccination credentials, are within the compliance regime that is in place. And that's an important point. It's an important point because what we are discussing here is the long term and the medium term. This process that I described to you is not a concept. It's already ongoing in countries like Kenya and Ghana and others. More and more countries are actually signing on. And in the coming weeks and months, you will see this AU platform at work in more and more airports around you. The real question is, how can we trust the process? And the purpose of this convening is that the ASLM is considering throwing its really impressive technical weight behind the improvement of this system that Africa CDC has birthed. And the fundamental issue is straightforward. If a laboratory is considered valid, is considered authorized by a particular authority in a particular jurisdiction, should other jurisdictions accept it? And how do we harmonize the standards to a certain degree such that all the different jurisdictions in a particular political union are comfortable that the test results or other credentials, including vaccination records, generated in one territory apply in their territory because they have a high assurance that the standards that are being met in that particular laboratory that generated it is equivalent to their own? I've described a number of processes.
1 minute left. Okay.
I've described a number of processes for this kind of bioscreening, preventive bioscreening and mass diagnostic systems. One is the mutual assurance protocol, by which one country is able to determine which laboratories in other countries match their standards. A second is accreditation data that can be provided by the likes of ASLM that is available to the different member states as they make that determination of which labs to accept. A third is the continued use of machine learning algorithms and big data algorithms to cross match and to triangulate data points from multiple sources in order to validate the results that are being generated. We hope that the discussions we have today will not only affect travel, but will affect a wide range of mass diagnostics possibilities and prospects that will affect multiple contexts of the health ecosystem in Africa. Thank you very much.
Thank you so much, PanaBios and Dr. Adam, even for this wonderful presentation. This is the future, and this is already happening. I was reading an article that the International Air Travel Authority is already making such considerations, and the lab is playing a bigger role even on this particular platform. So we want to begin to discuss this as a continent. And I can see some very interesting questions are coming on the chat box in terms of how does our lab join this platform. So please keep the comments and the questions coming, and we are going to move to the next presenter. I would like to leave this time to Dr. Tokumo Maruta, who is going to be talking about the ASLM certification program that is being proposed for the COVID-19 testing laboratories. So over to you, Dr. Maruta.
Thank you very much, Mr. Ndlovu. Let me begin by thanking Dr. Ahmad for his kind opening remarks. Also the chair, Mr. Ndlovu, who is also the CEO for ASLM, and our colleagues from PanaBios. So I think my task has been made much easier by the presentation from PanaBios. We have really laid down the groundwork in terms of why we need to have an organized and regional accepted platform for validating the laboratories that are producing the much needed results for COVID-19 testing. When I look at the concept of today's discussion, my attention is caught by the words Trusted Laboratories COVID-19 Testing Network. With the little understanding that I have in English, when I look at the word trusted, this would mean that it is a lab that I can go to with confidence, with no doubt, a lab that is reliable in terms of the correctness of the results that it issues. Many of you are scientists here and you call that accuracy. I'm also looking at the lab that is able to, that is consistent in terms of their processes, which you would call reliability. And of course, a lab that is acceptable time frame from the time that the sample, my sample is collected to the time that I get my results, which we call timeliness, or commonly referred to as the turnaround time. Now, the question that we would then have is, how will we know as the public health system, how will we know as the general public that this laboratory is actually a trusted laboratory? That's the question that was posed by PanaBios. That's the question that we would like to answer and provide a mechanism and a system for you in this presentation. When you look back, way back at the beginning of the pandemic in February 2020, the WHO issued their strategy on preparedness and response to COVID-19. Key in this plan was the identification of cases through laboratory testing. So laboratory being central, isolate them or treat them accordingly. Now, consequently, lab testing capacity rapidly then rose from just 2 labs able to identify SARS-CoV-2 around the 14th of February when we identified the first case, to almost 24 labs by the 20th of February, and almost now all countries by the end of the year 2020 being able to identify SARS-CoV-2. There were many platforms that were introduced, from the traditional PCR to more recently the antigen-based RDTs, as well as recently starting to see the more point-of-care based testing platforms. This broadening of testing capacity saw a rapid increase in the testing from a mere 778 tests by day 30 of the pandemic to over 1 million tests by day 90 of the pandemic. Now, we said there is expansion of testing capacity. And that when we conduct these tests, there are key questions that we need to answer. One of these is that, do these testing facilities meet the criteria of a trusted laboratory? In order to answer that, there are 3 ways that possibly we could come up with an objective answer as to whether this laboratory, is it a trusted laboratory? We can either answer yes or no. So firstly, the facility needs to be conducting quality assured testing for the SARS-CoV-2. Many of you here would know what this means. There are a lot of processes that they need to put in place to ensure that the end result they come up with is a quality assured result. Secondly, in order for us to provide that evidence that indeed this laboratory is conducting its tests under quality assured processes, we need to have then a standardized process of evaluating this quality assurance process that they are implementing. Thirdly, once evidence has been provided, once the process has been evaluated and is seen to indeed meet the requirements of quality and competence for producing these quality assured results, then there is need to provide that recognition to say Laboratory X or the National Microbiology Laboratory in Lilongwe, Malawi, indeed is conducting quality assured SARS-CoV-2 testing because we have evaluated their system in terms of the quality assurance programs that they are implementing. When you look at the Africa Union Trusted Travel Platform that our PanaBios colleagues have just been talking about, they really emphasize on certain points, one of which is there is a need to create that database of authorized laboratories that are indeed authorized or certified by the country to conduct the COVID-19 testing. He kept on emphasizing on this point that these laboratories need to be authorized to say the Laboratory X is authorized by the Ministry of Health in Namibia, by the Ministry of Health in Tanzania to conduct COVID-19 testing. So here is the question. How do we prove, or what evidence do we need to show that this lab is doing a quality assured testing? What is it that we need to put in place, or what do our governments need to have as a means to say we are authorizing this laboratory to conduct COVID-19 testing? This is where the African Society for Laboratory Medicine COVID-19 Laboratory Testing Certification Programs then comes in. Now, looking at this program more closely, how does it look like? How is it going to be functioning? Structurally, we already have requirements that have been published and out there by WHO in this a number of interim guidance that they've given and issued out in terms of the requirements for quality, requirements for biosafety, and requirements for biosecurity. Therefore, this system that we have to come up with has to comply or be looking for those laboratories that are complying to these requirements that are already issued out. The system or the program will then evaluate compliance using standardized assessment tools. This is very important, such that we use tools that are standard, tools that are checking compliance to already existing requirements that are already issued and most of us are aware of. Then following this evaluation, authorization can then come in if the concerned laboratory is meeting the requirements as stated by the many guidance that is already in existence. In terms of the process, key to this process, the Ministry of Health should and must remain central to the process. The Ministry of Health, as the coordination agents, will ensure that this whole process becomes institutionalized within the structures and systems of our governments. We want to task, or it is proposed that the ministry be tasked with identifying and prioritizing these laboratories that can either be public laboratories or private laboratories, coordinate the process of organizing applications and submitting them to the ASLM Secretariat. Once ASLM receives this request for enrollment, it enrolls these laboratories into this certification program. Key to this is the enrollment process, because a laboratory may be assessed today. It may not necessarily mean that it will be able to meet all the requirements. We don't want to throw away this laboratory, but keep it in the program as we help it to take those step-by-step process until it reaches and meets those requirements as stated by the program. So laboratories have to be enrolled into these programs, and where they don't meet requirements at a particular point in time, they can still be assisted through the Ministry of Health, through ASLM, to make sure that they meet the requirements through mentoring and technical assistance. Once enrollment has been completed, the ASLM Secretariat then takes the responsibility to deploy its assessors or auditors to go and evaluate this laboratory for compliance using the standardized tools that I referred to ensure that the process is institutionalized within the government, to ensure that the process is also cost-effective, as mentioned by PanaBios. ASLM wants to take advantage of already existing capacity within our countries. In many of our countries that are here, we already have the ASLM SLIPTA certified auditors. They already have the competence, the skills. What is then required is to orientate them and train them on this specific tool. Otherwise, the skills that are needed and the capacity that is needed already exist. This also makes the process much more cost-effective by using the local available expertise and resources within our country, of course, through the coordination of the ASLM Secretariat. In terms of the certification process, ASLM then, after the audit or the assessment, the Secretariat then reviews these reports based on the audit findings. Key to this process as well is that during the process of auditing, there is also mentorship that is already taking place, especially in those areas where gaps are identified. So it is key that a discussion takes place during the audit and following the audit as the auditors present their audit findings, so that the lab can start to be assisted already in terms of where they need to go to meet the requirements. And then, of course, there is a recognition process that is being proposed, whereby a lab can be audited. It is recognized at a certain level on an incremental scale of 0 to 5 stars, similar to the SLIPTA process that most of you are aware of. However, only those laboratories that reach or attain the 5-star recognition status will then be awarded or authorized as COVID-19 testing facility. So very important. You could be audited today, get your 3 stars, you'll be helped by the ministry, you'll be helped by ASLM, but only those that reach or attain a 5-star recognition, or at least 90% of the requirements of the checklist, can then be authorized and given a certificate that says you are now authorized to conduct COVID-19 tests. Just to look closely at the checklist, just briefly as to how the assessment tool would look like. Of course, the tool is based on the known standards for quality, competence, biosafety, and biosecurity. Your standard 158-189 for your medical laboratories, 17025 for your other testing laboratories, including your vet labs, your research labs that are conducting COVID testing, 15190 for your safety, The new WHO Biosafety Manual, the 4th edition, very important. The continuous guidance that we get from WHO, and of course, your good laboratory practice. So the checklist, the tool, is based on these known and widely acceptable standards that are out there. In terms of its scope, it has 5 sections that it is looking at. The first section is going to look at your laboratory policies and procedures that relate to the COVID-19 testing. So we are looking to check whether do you have the standard operating procedures for your COVID-19 testing platforms that you are using, if the staff been aware of these and are these available, and so forth. Secondly, looking at the capacity of the laboratory. We don't want a lab to be authorized to test and then it starts having 7 days, 8 days turnaround time. That will not be acceptable in terms of quality. So looking at the capacity, the staff, the training of the staff, the equipment that it has, these serviced, and all those areas for your process improvement. Quality assurance, of course, to ensure that the test that is being conducted is quality assured, as indicated at the beginning, your IQC, your EQA, and so forth. Of course, management of your data. Some of this data has to be held in a confidential way. Is it being kept in a way that is retrievable at some time? Are you sharing with all the required and needed areas for COVID-19 response, your national task force, your surveillance teams, and so forth? And of course, the SARS-CoV-2 is one of the high-risk pathogens. Therefore, the issue of biosafety and biosecurity is very important. The certification recognition. 5 minutes. Thank you very much. Yeah, the recognition certification that I've spoken about. So we're using the standard 0 to 5 star recognition, and at each audit, you are then recognized at what level you are at that particular time. And certification only takes place, or authorization to be listed on the trusted travel platform can then be awarded if you reach a 5-star level. The standard checklists, like your will have the checklist question, the questions that it asks, then it's the level of compliance. If you have met all the requirements, you get a yes. If you've partially met them, you get a partial, and so forth. And then the scoring depends on your level of compliance. And of course, each time that you get a partial or no, the auditor has to explain what needs to take place as a basis upon the lab starts to work towards those improvements. Now that we have this platform, now that we are launching this certification program today, what are the immediate next steps? I'm reliably informed by the CEO of ASLM, who is the chair today, Mr. Ndlovu, that we need now to mobilize countries to start adopting the trusted travel platform and the certification program that we are launching today. We need to quickly move on to the training and orientation of our ASLM certified sleep auditors, and in those countries where we don't have, start training them. Of course, we have said the Ministry of Health is central in this process. Therefore, all nominations, selections will be coordinated through the Ministry of Health. Conduct the training to build a pool of auditors and then start enrolling the laboratories, deploy audit teams, recognize them, and then certify or authorize those that attain 5-star requirements. And of course, importantly, labs that are enrolled and don't meet the 5-star requirement now, we don't throw them away. They are enrolled in the program. And then we continue to assist them by provision of technical assistance, as well as mentorship through the coordination of the Ministry of Health and many other partners that are involved in this process to ensure that they can attain that 5-star recognition. With this, Chair, I would like to take this opportunity to thank everyone who has listened, and hopefully we'll have a little bit of time for questions.
Thank you so much, Tokmo, for that presentation. So I see there are lots of questions that are coming through, and we hope to touch as many as we can and respond to them. So thank you so much for the presentations. So let me jump straight into the comments and questions that have been coming through the platform. The first question is from Abayomi Abbas. And the question is, what chance does lateral flow devices has in keeping the gates of Africa safe for passage, when in actual sense, most of our land borders are either porous or too weak to base cross-border movements on a very elaborate test such as PCR. Tokmo, do you want to take this one?
Thank you very much, Chair. I think the colleague is asking on a specific, testing procedure of platform and how this can safeguard in terms of quality. I think there is a lot of, literature and research, and also when one visits the WHO website, they will also be able to see some of the approved diagnostic platforms that have been made available for use, whether, of course, the traditional PCR and some of the antigen-based rapid diagnostic testing and point-of-care testing. So I think my response would be that we need to, look at the guidance that has been provided by WHO in terms of what sort of testing platforms are approved or have been evaluated to ensure that we give quality and keep the safety of our patients. Over to you.
Thank you so much. Another question that keeps coming, and I think it's one of the most common questions, is which are the labs that are going to be part of this trusted platform? And how does one lab join this platform? Does it allow for private laboratories to also join this? Who is responsible for listing these laboratories? Maybe that's the question.
Thank you very much, Chair, and thank you for that very important question. So all laboratories are essentially welcome to join this platform. What is key is the coordination through the Ministry of Health. So each of the our governments have programs that they've put in place in terms of their response to COVID-19. Within these programs, they have prioritized the laboratories that they would like to be considered for or be used for COVID-19 testing. These could be private, these could be public health laboratories. So through the government, we will be working with the Ministry of Health to coordinate the process of enrolling laboratories into the program. So, but basically, all laboratories are welcome to join the program and get enrolled into the process. In terms of when this can happen, it has been launched today. We are going into full gear beginning today to ensure that we start the process. And through the systems we've established through SLIPTA, we already have some of these focal persons, we already have contacts with the different ministries of health, and we will be beginning the engagement process. I hope that.
So thank you so much for that response. I want to also add and make a clarification that the responsibility of selecting and listing these different labs in a country, it lies on the Ministry of Health. So these are going to be, excuse me, can we all mute our phones and gadgets? Thank you so much. So the responsibility for listing and selecting these laboratories lies on the Ministries of Health. So ASLM is not going to come to your country and select a lab, but we are going to be working with the Ministry of Health to list, to support those labs that have been listed so that we can raise their quality for them to be part of this trusted platform. So the Ministry of Health will take the leadership in identifying and listing these labs. Is already happening in many countries. Some are from the private sector, some are from the public sector, some are even veterinary labs. I know of some in many countries. So all that is the responsibility of the Ministry of Health. So ASLM is coming to support these laboratories to lift and raise their quality standards so that they become part of this trusted network of laboratories. So there's a question that keeps coming that will be important for discussion. I'll just pause this. The issue of data privacy and confidentiality. So I would like to pose this to PanaBios. Do you want to comment on that? The issues of patient data, and it's a question that has been coming up even during the presentation. How are we dealing with the issues regarding participant or patient data safety? Over to you for your response.
Thank you very much, Mr. Chair. Obviously, there are three dimensions here. The first dimension is standard cybersecurity. We should be able to ensure that we are securing the data vaults. That's critical. The second is authorized access. And the third is legitimacy of access. So I will start it from the bottom. From a legitimacy of access point of view, who has the right to demand particular types of data and to store that data? I will point members to the current API PNL process that enables aviation data to be sent in advance. So if you board on an airline today, your passport number, a whole range of other types of information, including questions that you are asked by the security consultant at the boarding point, are sent in advance to the country in which you are going to. That is enabled by United Nations Security Council resolutions. Now, the health screening in respect of travel falls under the similar arrangement because this is biosecurity. So very similar to the same national security, anti-terrorism, anti-money laundering mechanisms, which are subject to international law, which enable the movement of this type of data. So from a legitimacy point of view, so long as it's going to a government in the context of a pandemic, both the international health regulations and existing UN precedent establishes the basis upon which this data is being shared. So we move to the second issue beyond legitimacy to unauthorized access. That is governed by Africa CDC, AU, and then in some of the regional economic communities, we have specialized health agencies like WAHO that have already developed data sharing protocols about how to ensure that only the right people have access. So the authorization regimes are going to be respected, and they are being respected completely. The last point is cybersecurity, which is much harder a question to address. But cybersecurity really is a matter of the investment that is being made, which is why the African Union has thrown up this invitation to private sector participants in this scheme. And they are bringing in the resources that are necessary to ensure that we continue to secure the data vaults and prevent malicious agents from trying to penetrate the data vaults. So those are the three levels of answers. Thank you, Mr. Chair.
Thank you so much for that response. I would like to take one last question. I know we are just above the hour. So talk more. Can you answer this question that keeps coming? Is this certification going to be for the PCR labs, or does it also include the RDT testing that is now decentralized across many places?
Thank you very much for that important question. At the moment, we are relying on the fact that for travel, most countries are accepting PCR-based testing. Therefore, at the moment, the tool or the program is earmarking those laboratories as has been accepted generally for travel purposes. However, the tool that we are developing is generic to the extent that it is very much adaptable if the situation changes and other forms of test results become acceptable for traveling purposes.
So thank you so much. I don't intend to take much of your time. Any last few remarks from PanaBios concerning your presentation and some of the questions that have been coming through the chat box? PanaBios, do you have any last few remarks? You're on mute.
Sorry, Mr. Chair. No, we are very grateful to the ASLM for this opportunity. The work that Africa CDC is doing, which we are supporting as a consortium of Pan-African institutions, is extremely critical. And we are happy that an organization of your caliber has seen the need to really put behind it the weight of your technical sophistication and competence. Thank you very much.
Thank you so much. Chokmo, any last remarks?
Thank you very much, Chair. Just last few words to say, for those member states that are here in this meeting, and you haven't joined or considered adopting the Trusted Travel platform that Africa CDC launched a few months ago, I think this is the time to do that. Everything is going digital. This makes it easier for your traveling and accepting your travelers that are coming in. Secondly, the African Society for Laboratory Medicine has a proven record when it comes to quality management systems and strengthening of laboratories in the Africa region. And their track record also has volumes from the WHO SLIPTA program, and this certification program is not different from that. So this program that has been launched today is being launched by organizations that have a track record for working closely with your governments, and this platform is a platform that you should take up as soon as we close this meeting. Thank you very much for everyone, and thank you, Chair PanaBios.
Thank you so much. I would like to thank you all for making time to be part of this webinar. I would like to assure you that most of the questions are going to be answered. We are going to be seeking the answers from the experts, and we are going to publish those responses. And thank you so much for the questions and the comments that you are putting on the chat box. So we are beginning a journey together, and as the pandemic evolves, we also have to be responding and also staying ahead of this pandemic. And this is another step again. As borders are being opened, there's a lot of concern in terms of how this is going to be managed. And this is an effort really to build trust so that travelers can have seamless travel. So thank you so much for being part of this webinar. We are going to be sharing the presentations and even the video, and also we are going to be sharing some of the responses to your questions. So at this point, I would like to declare that this meeting has come to an end. Have a wonderful day. Thank you. Bye-bye.